I'm Tressa Muller. Today is December 6th at 11:25 and I will be doing my Foley catheter video. So before entering the room, I'm going to grab a catheter kit, peri wipes, and make sure I have an order from the doctor to perform a Foley catheter on this patient. When entering the room, I will state my name, Tressa Muller, and an RN. I will say that what I will be doing, the procedure, and answer any questions. I will also verify their name and date of birth with their bracelet and any allergies like that they might have, especially iodine. So after I have verified everything and answered all their questions about the Foley catheter, I'm going to lay them down. Putting the bed to working height. I'm going to provide privacy, perform hand hygiene, and put on clean gloves. I will pull down the blankets, making sure the bed is flat. I'm going to pull up their gown, position their legs correctly. Now that they are positioned correctly, I'm going to perform peri care. I'm going to grab a peri wipe. I'm going to wipe from front to back. Using a different part of the wipe, I'm going to wipe the other side, front to back. Throwing this one away, I'm going to grab another one and wipe just straight down the middle. Throwing that one away. I will take off my gloves, perform hand hygiene, and getting ready to open the sterile kit. So I'm going to open away from me, to the side, and towards me. I'm going to grab my drape. Now that the drape is under the patient, I'm going to put my sterile gloves on. Putting my right hand in, not touching the left glove with my thumb. Now that my sterile gloves are on, I am going to prepare the rest of the catheter solution. Okay, so I'm going to open the betadine and pour it over my cotton swabs. I'm going to take the 10 ml syringe and verify that there's 10 ml in there and it is sterile water. I'm going to place it onto the hub of the catheter, making sure that that also reads that there is 10 ml allowed into the balloon of the catheter. I will open up the lube, squirting that into the tray. Now that that is ready, I'm going to remove the sheath from the catheter. Placing the catheter into the lubricant. I will now grab a cotton swab. With my non-dominant hand, I'm going to spread the labias from the furthest away from me. I will wipe front to back, closer toward me, front to back, and straight down the middle. So now that the peri area is sterilized, I'm going to pick up my catheter. I'm going to insert the catheter Once I see urine return, I will advance 2 to 4 more inches. I will blow up the balloon. Disconnect the syringe. Now that the catheter is in place, I'm going to take off my sterile gloves, perform hand hygiene, putting clean gloves back on. I'm going to attach the catheter to the patient's leg, making sure that there's enough slack for the catheter. I'm going to attach the catheter to a non-movable part of the bed that is not touching the floor. Once the catheter is in place, I will initial date and time it, cover the patient up. I will perform also peri-care before getting them back to the comfortable position. I will just be wiping the iodine, as much iodine as I can, off the peri area. I'm going to cover the patient up, making them comfortable. Get the bed in the lowest position in their call-out and reach. I will document the amount of urine, the size, if there's any odor, and the color of the urine, and also how the person tolerated the procedure.